I went and had the chest x-ray. She said, you won't hear from me for 5 to 10 days. Well, we heard on the Monday that I had some sort of mass. And then she tried to get me into the fast track the next day, which was first Tuesday. I went the following Tuesday. We saw a nurse called Liz. She was fabulous. She explained everything. We never felt as if we didn't really know where we were going. No, it was very
Everybody was very good, really.
Yeah, they were. We went and saw Dr. Isles, who explained this, saying that he thought it was cancer, blah, blah. Had to investigate further, so I was going to have a CT scan. Then I had a spirometer or something like that, yep, and ECG. And then they said, depending on the CT scan, would determine whether I was going to have the CT biopsy. Yeah, so we knew that was all going to happen in that day.
Let's get it done.
Well, it's waiting. You know, it's not just waiting for me or Steve, it's waiting for the whole family. Yeah, at least we knew what was going to happen, and it was potentially cancer. Yeah, it was quite, I wouldn't say comforting, but yeah, at least we knew, well, a reason why I was feeling unwell too.
Yeah, I thought the fast track was really good, especially Liz, was it? Liz, she was really good when we first got there.
She was amazing. Always checking if we were right. You know, you can make a tea and coffee over here, and do you know where the bathroom is? And then when we got and we had that first time with Dr. Isles, she let us have a clinic room that was empty, so we could just have some time out as a family group rather than sitting in the waiting room with everyone else. So that was really nice. She just, you know, she was really good.
Company, eh?
Yeah, but she wasn't too over the top. She just understood. She just knew.
We had another appointment with Dr. Isles, excuse me, about a week later, and he just explained that it was definitely cancer. Well, actually on the day too, he explained that I had the cancer there, but I've got a small cancer in my adrenal gland as well. And then that appointment, the next Wednesday's appointment, he explained that it was definitely cancer, and what they were waiting for now was that they were going to do a genetic test on the biopsy to determine what kind of chemotherapy or whatever they were going to use. Yeah.
Yeah, it's pretty hard watching Mum get bad news and watch Dad and Darren.
I mean, we went through it with Dad earlier on, and that was pretty tough. All the waiting and all that, and then got the clear from that, and then didn't expect to see Mum.
Mum's so fit and healthy, and you know, there's never anything wrong with Mum. You know, Mum's always looking after us, so that's a bit of a shock.
Yeah.
Parking was the worst thing down there. It was bad. Real bad. We ended up outside the dairy down Manu Road. We'd been up the back of the hospital, right round the hospital, reversing. And so frustrating. But it wasn't just us, it was the rest of the family couldn't get a park either.
And it was kind of a stressful situation because we were
right
waiting for
half
that
an hour
appointment.
early.
Yeah. And we couldn't, yeah. And we
And we
ended
were
up
almost
being
late.
But I think if families have to go through what we're sort of going through, it's got to be quick. You've got to have the information as soon as you can. And then, because you imagine things, you just imagine over that
Even
time,
now we are.
in that time period, yeah. Say it was 2 to 3 months, so you're waiting. You know, your imagination plays tricks. You'll have yourself dead and buried.
It's really important for all of us to be able to be there together. You know, it would have been horrible if Mum had been dragged off into a room by herself, or just Mum and Dad could go, and then they had to come out and try and relay all the information to us, and they wouldn't have been able to get all the information across to us because they would have been in shock. At least we could sit there and hear it from the doctor ourselves as well and ask questions.
To get it done in one day was absolutely brilliant. I was actually talking to my doctor yesterday. He said in the past it would take a month to get in to see a specialist, and then it would take 5 to 6 weeks to do that sort of biopsy situation. Then you'd have to have another appointment with your specialist to find out whether you had cancer or not. Then they'd be in the position that we are now, waiting like 3 weeks to go to oncology. So, you know, that's a horrendous time frame. and very stressful on families. Yeah, so really appreciate it was done in one day.
Mine's a bit,
It's been a
bit numb for the
long
last.
wait now from having a diagnosis to finding out what sort of treatment she's going to have. I mean, that'd be nice if that was included in the fast track concept that you guys have, you know, because that's been a little while now.
I
We
think
don't sort of know what's happening.
The waiting is just the hardest thing, so that's why that fast track thing is really good.